we are going to be doing a live broadcast this evening with Patrick Delves, and I want to encourage you to call up your friends and call up whoever and share the live. Let them know that Patrick is going to be talking about breast cancer. We're going to be talking about prostate cancer. We're going to be talking to men who are having problems finding an erection. We're going to be talking about women who have lost their breast or are about to lose their breasts. We are talking to Patrick Delves. We want to speak about viral load, and we want to talk to him about how to build up your immune system. So please share this live, share this broadcast. Let folk know that we are doing this Herbal Life program tonight. We're coming in live from Brooklyn with Patrick Delves on your, not your TV, but on the internet, on Facebook Live with John Crow. So you can tune into my page, take the link and share it with as many people as you can. And we want to bring as many people in on this broadcast as we can. Yes, so please stand by. We're getting ready to roll, and we're getting ready to bring in Patrick in a few minutes. So call a few people and let them know that we are live, and we are in Brooklyn, and we're going to be doing this broadcast tonight with herbalist Patrick Delves. Yes. All right, folks. Let me. We have him sitting in front of me, Patrick Delves, one of the hardest men to reach. You know, took us about 5 hours to do this setting up here tonight, but here we are. And first of all, let me start out. Normally, when you start out, you normally say, "Okay, build up the live, build up the live."
Build up the live.
Call somebody and tell him Patrick is on the program.
Yes.
The quality is good. The audio sounds good.
Yes, sir.
Okay. Let me. Shanti, are you able to see us at all? Yes. On your thing, on your device. Your light is on. You're not uncomfortable, right? The light is not.
No, I'm good.
You good?
Yeah. Man.
Oh, okay, good. All right. So tonight, Patrick, I want us to delve into a few areas.
Okay.
I want to talk about men and their prostate.
Mm-hmm.
I want to talk about husbands who cannot satisfy their wives anymore.
That's a tough one.
Okay. I want to talk about breast cancer.
Mm-hmm.
I want to cover that.
Right.
I want to delve into, you've been through it, this whole COVID, forced vaccination,
mm-hmm.
no vaccination, anti-vaccination, vaccination, and all of that exciting stuff.
Yeah.
And no particular order. I just simply want us to cover it and to give people who are listening and watching, I mean, you have your audience, a sense as to where they can go, that it's not all lost once they contract, especially the virus.
Well, I had it so, and I have my proof to show it too.
And you had it too?
I have the proof too.
And you had it too?
Uh-huh.
So we have all that?
Yeah.
Yeah, well, let's get it. Yeah, let's get it. I mean, we have it, let's do it. So, folks, these are the areas we'll be covering this evening. We want to...
Because I don't have it in here. I think I left it in the apartment.
Oh, you don't have it in here?
Yeah.
Oh, okay.
But I showed it last night on my live, you know, so...
Oh, okay.
People saw it. Oh.
Okay, so we're good?
Yeah.
All right. So, you are someone who really need no introduction. Mm-hmm. And I don't really know that I need to go into any heavy introduction, but for folks who have never heard of you or never seen you, I want you to take a second and just tell them who you are, where you're from, and, oh, okay, sorry. Thank you, Joe. And, okay, so, all right, so then my other, okay, fine. Okay, now I know where I am. So yes, take a minute and tell them where you are, where you're from, sorry, not where you are, but where you're from, and who you are, and the kind of work that you've done. As a matter of fact, before you even say that, I had to bring you up to speed. I had a lady the other day who posted a live, and she was complimenting you for helping her daughter, who said you got a daughter pregnant.
Yeah. 32 of them.
Oh, 32 of them?
Yeah, 32 women.
That you got pregnant?
That got help to get pregnant.
Oh, you helped get pregnant. Well, you didn't get them pregnant.
No, sir.
Well, I want to, just to be very clear.
Next time the husband's coming and look for me.
No, we don't want husband coming and look for me. Okay. So, Patrick Delves, yours?
Yes, sir. Oh, you know, I'm from the island of Grenada, a very small island of 132 square miles, 90 to 100,000 people. And I was born on August 21st, 1955. So I am 66 years of age. And growing up, you know, my mom and my dad, I had a lot of trouble with epilepsy. We call it seizures, you know, in the Caribbean. We call it epilepsy in the medical system. And then I had high blood pressure, and I had a stroke. And after my stroke, I got serious about life, man.
You had, how old were you when you had the stroke?
32 years old.
At 32?
Because my mother died from, the second stroke killed my mom. She had two because my mother had high blood pressure.
But how old was she when she died?
97. 97.
97, right.
Yeah.
I remember you and her on the beach. Mm-hmm. You taking her to the beach.
Right, and that's her first stroke.
Okay.
And the second stroke, she couldn't even walk. And then she died, you know, because she had high blood pressure.
High blood pressure.
And I attained high blood pressure also, because I was eating the same way.
Is that what got you or launched you into?
Yes, sir.
Okay.
Yep. After my first stroke, I realized that the doctor was saying I could get another one. Because once you had one stroke, you can get another stroke. Okay. It's according to what you do. So I had to make a lot of changes.
Because when I first met you, you had no interest in herbs.
Oh, no, I do music, right?
Music was the thing, and hopping all over the stage and singing out a tune, but anyway,
that's what I'm saying.
Trying to sing reggae music now, like.
Yeah.
No, you do have a good voice.
Yes, sir.
And right. For those of you who might not know, he does have a very, very good voice. Just I have to say that.
Yeah.
So at 32,
I had a stroke. Yeah. And after my stroke, I was on about 6 or 7, but let's say 9 medications. Because anybody who have a stroke, the doctor will tell you that you have to go on Novax, Ifedipine, now they have Losartan. I used to take Zestril or Linezolid, the same drug. Then they give us black people hydrochloroside, I believe, it's a water pill, or Bearzide or Lasix. I was on all of them. And then I will give you a high cholesterol drug, then aspirin. That was the norm. Still is the norm today when you have a stroke. You know?
What can we say to a doctor, or should say to the doctor?
Mm-hmm.
Because the medication that they prescribe to us are more Eurocentric medication that they're giving us than, and does not necessarily mean that it's, what's the word I want to use? Complementary to our system, African-American system, or African people of African descent system.
Yeah.
But they push these drugs on us because that's what they know.
Well, because that's what they were taught in medical school.
That's right.
And I understand that. So the average doctor doesn't think out of the box. Because when I had my stroke and after I got the pills, the drugs, they told me I have to take that till I die, till the rest of my life. And to me, that was a death sentence. Because you know when you have high blood pressure and you're taking pressure pills, it messes with your penis as a man. A lot of black men, that's why a lot of black men don't want to take the drug because they
right here. Excuse me. I don't have a mute. I don't have a mute button, so I can mute my cough. But anyway, high blood pressure pills. So now I started, and I true confession here. At first I was pre-diabetic. I think they tell me now. Not pre-diabetic, hypertension.
Okay, it was either borderline or...
Borderline.
Right. So you're looking at 140 systolic, 90 diastolic. That's mild to moderate hypertension.
Okay.
You should never go on drugs for that.
But they give you that?
Because doctors are not nutritionists. They know nothing about nutrition.
Okay.
So they only had 4 hours of nutrition in 10 years of going to school. So they don't know how to treat you in a nutritious way. So they say, okay, you have a pressure of 140 over 90, which is mild to moderate hypertension. Shouldn't be on drugs for that, but they give you a drug because that's what they know. So they don't think out of the box.
So when our women get frustrated with their husbands or their boyfriends because the man is not able to stand up, as Jamaicans would say, he can't. The body don't stand up no more.
It's called ED, erectile dysfunction. Yeah, or they call it impotence. Two different kinds of trouble in men. You know, one is called ED, which is erectile dysfunction, and one is called impotence, where you just can't get an erection at all. With the ED, you can get an erection, but you don't keep it. Because a few things will be happening. You either have a blockage in the arteries, in the pineal artery, where the blood gets into the penis, but it don't stay there. Because there's a valve that keeps the blood, that helps the blood from, prevent the blood from coming back. You know, that blood goes in, and you get an erection, but because the valve is not being closed properly, the blood comes back out. So you go in good, but the blood comes back, and you go back down.
So it's leaking.
Right, that's called ED, that's called erectile dysfunction. Impotence is totally different. Impotence is when you not get an erection at all, period. And that's for older men who was lacking in testosterone.
Well, my grandfather went out at 98, and he was still dropping sods.
Right, you see, because he maybe ate different.
He had a mixture with whale oil, Guinness, lemon, and a few other things in this in this bottle. I used to call it the rusty bottle.
Yeah.
I never did get the recipe, but my cousin told me he has the recipe, and I plan on getting it from him because I want to be going out at, you know, I want to still be up there, you know,
do it, man.
doing what I know. Yeah, I'm a Grenadian. I mean, you know, we like the thing.
Yeah. You can if you, because a lot of us when we get older, we don't seem to, remember that our organs do not work as good as when we were younger. That's number one. Number two, we men do not produce sperm every day once we pass the age of 30. We produce sperm every 3 days. And there's a gland called the prostate gland that is very significant in our sexual health. So if we keep on having sexual intercourse on a regular basis when we pass the age of 30, then we are putting the prostate at risk. Because now the prostate has to secrete that prostatic fluid to send that prostatic fluid into the testicles so that we men could have good sperm velocity. But because that age brackets between 30 and up, we don't produce sperm every 3 days. If we're having sex 4 and 5 times per week at 30 and 35, now we are forcing the prostate gland on a regular basis.
So is that why we have so many men with prostate problems?
Yes, sir. That's why if you look at Ellie Purcell, he died from prostate cancer.
Right.
He had lots of kids.
And he had a lot of children.
Right. My father, who had 30 kids, died from prostate cancer too. So a lot of the older men, when there was no TV and radio, sex was the only thing they could have. You see what I'm saying?
So,
you know.
so Patrick, hold up a second. You're telling me that having sex regularly is a bad thing?
If you want to pass the age of 30.
After 30 years old?
Let me give you an example. When we were 18, 19, and 20, and no man could do that either, we will have sex 5 times per night. Do that at 50, you can't. You think what happened?
Well, I never tried that. I wasn't having sex at 18.
I'm only saying.
I was scared.
I'm saying.
I didn't know how to approach the women. And then.
But I mean, you know, I've been there, so I could tell you.
Right.
So I'm saying that, you know, because when we get old, we get wisdom. And then you use that wisdom to teach others so that they don't make the same mistake. So when we were 20, 21, 22, we produce sperm every day. So we could have sex now, have an ejaculation, and then in 5 minutes, we up again because we are producing sperm every day at that particular age. But once we pass the age of 30, we do not produce sperm every day.
So when Lionel Richie's song talk about all night long, all night.
I know you're talking all night long. I know you're talking about.
We know all night long.
All night long and last for long. Because you see, that's why they have so many sex pills on the market. You see what I'm saying? Because lots of men is not educated about sex. Is
it safe to take those Cialis and those things?
I don't need them. I don't think it's safe because they could give you a heart attack. They force the heart. I mean, there are herbs that do the same thing too, like yohimbe. Yohimbe will give you a good erection,
right,
but it also makes the heart palpitate.
Okay.
If you have troubles in your heart, so if you have congestive heart failure, if you have a weak heart, if you have high blood pressure, it is very imperative that you learn not to take these herbs, because they can push the heart to the limit and cause you to get a heart attack while you're on the box too.
While you're doing that?
Yeah.
So then a few people that we know, I mean, I know a few people who died on the box.
Yeah. After ejaculation, because once you ejaculate, the heart beats a little faster. You see what I'm saying? That's what's happened to them, you know.
Yeah.
Once you ejaculate, and you know your heart is going to beat faster. That's common sense.
There's one case that come to mind now from Ladig, over there by where Junior George come from. Mm-hmm. This guy, you know, he had one night he decided, you know, drink, what do you call the thing again, that thing in the can they drink, what's that thing that they drink?
Red Bull?
Huh?
Red Bull?
Red Bull.
Mm-hmm.
So you drink your Red Bull, you mix it with some Bourbon and something else, and he had 2 women that night, and he going like, I'll kill it tonight.
Yeah, you can't kill that.
And then he ended up dying.
Yeah, you can't kill it. You can't kill it. You can't kill something that baby come from. That's common sense.
We don't think about that.
Because we were not taught the right way.
Right.
So you have a baby coming from a vagina, it expands, yeah, and we could try to say we're going to kill it, but then when we reach to be at 50 and the woman is still there, and she's waiting and we can't do it because she kill you eventually.
You end up dying. You end up dying. But okay, why? Okay, how? Okay, tonight is a night. This is Caravan Classroom. Tonight is a night where we're going to educate a few people. Mm-hmm. What can a men over 30 do in order to prolong the sex life?
The key is to don't ever feel that you can kill a vagina, because you can't. Thing will happen. You see what I'm saying? And number 2, once you pass a certain age, leave fried foods alone.
Fried foods?
Yes, sir.
Fried jacks?
Fried fish, fried jacks,
fish.
Fried chicken, fried this, fried that.
Anything fried?
Anything fried. After 30, leave it alone. Because all these capillaries and the arteries and the veins, they're going to get clogged up. And when they start getting clogged, then you're going to have the blood moving very slow. Just common sense.
Okay.
So because the blood's supposed to move quick. If you look at your bloodstream moving into the circulatory system, you get dizzy because it moves so quick. See, that's the way it's supposed to go.
Look like a highway.
It's like, that's it. Once it slows up, because of blockages to the arterial walls, then you're going to have troubles with sexual problems when you get to a certain age.
So, okay, no fried foods.
No.
I should tell people, I should warn you and get pen and paper and write these things down, because tonight you're getting an education for free. Okay?
Yeah.
For free. Because no fried foods past 30.
No. You shouldn't. Period.
Not even
no oils.
Recreational.
No. Well, I would say once in a while. Okay. And then you can clean the arteries by doing certain things. Because, you know, I could go into detail.
Okay, so we've gone past 30, and I want to go to cleaning the arteries. And we still, I want to touch, I don't want to spend too much time on the men. We have to get to the women and the breast cancer and so forth as well. Once you pass 30, and we now know that we're not eating fried foods, what other foods we should avoid? We should be avoiding?
Lots of flesh foods, especially beef.
Red meat? Yeah,
red meat. And the reason I want to say that because beef takes 18 hours to digest.
18 hours in your system?
To digest.
Before you could...
Right. And remember that we have 6 organs in our stomach too. You see? And a lot of men who use lots of bitter herbs, they get low sperm count eventually.
Who eat bitter herbs?
Who drink a lot of bitter herbs, like Morbi, cloves, wormwood, walnut, they're all bitter plants.
Right.
We as men are supposed to use them on a regular basis, only once in a while, because they could have us losing sperm. So a lot of us use a lot of bitters, end up having low sperm count. We can't have no babies eventually.
So when you put bitters in your drink?
Regular basis.
On a regular basis?
Cause low sperm count, yeah, not good at all. And then because we have 6 organs in our stomach, it is very imperative that we keep the stomach healthy. And then because the pituitary gland is very significant in our sexual health, men and women's sexual health, in the anterior part of the gland, I believe. That part of the gland deals with the sexual organs. So the endocrine system also have a significant role in us men keeping our sexual health. You know? And don't eat at night, period. Leave food in the night time.
Right, yes. I mean, after 8 o'clock.
After 6 o'clock.
Oh, 6 o'clock.
Yeah, yeah. Because you see, we have a concept or tradition, we call it. You know, Christ made a statement in the scripture. He said, we make the word of God invalid through our traditions. You see, our tradition is 3 meals per day. Right. Morning, afternoon, lunchtime, evening. You come home and the wife give you a big meal after work. 8 o'clock you come home and you just eat a big bowl of fried plantain, gravy, chicken or fish with rice and peas, and a big glass of juice or soda pops. And you do that for 20, 30 years. Your sexual health can never be good. Because when you're sleeping is when the body's healing. And then all of that food is in there. Sitting in there in the stomach and the gut. To do something. Yeah, well, it can't go to place because the body is regenerating. And then you have everything not being clogged up. And then number 2, you have all your healers or your protectors running to that particular area where all the food is at to protect you, but to leave other parts vulnerable, like the lung and the heart and the kidney, vulnerable to these pathogens. So because of the food you're putting in your system, so then your system is really working on the food, so to speak, and you're saying leaving the other areas open and exposed to danger. That's the key. So you're looking at the word break fast. We call it breakfast in the Caribbean, as you know, but it's break fast. Breaking your fast. Breaking the fast. You're not supposed to eat at night, so you break the fast the next day. Next morning. See, so if people could follow that principle, you know what I mean, by not eating at night, even men and women sexual organs will last a longer period of time. You know what I mean? If you can combine your food, what we call food combining, if you can combine your foods properly also, that's significant. Knowing what goes with what. Exactly. So I don't eat a starch with a protein. So I don't eat rice and peas. I don't eat rice with fish. In fact, I don't eat rice, but if I do, I don't eat rice with fish. Because rice don't digest in your stomach, it digests in your mouth and your small intestines. But the fish does. So if you eat them together, and the fish and the rice get into the stomach, the rice have to stay and wait for the 12 hours that the fish take to digest. And he's becoming idle. And he causes fermentation. So then that's starch? Yeah. And then that starch turns to sugar? Well, it turns to sugar when you digest it. When it goes from the mouth, it starts to turn into sugar chains already. Right. Because the amylase in your saliva start breaking down your rice, your starch, or your carbohydrates into sugar chains from the saliva. So digestion of starches starts in your mouth. When the starch gets into the stomach, the acid kills the amylase that breaks it down. So the starch can't stay. So it moves fast into the small intestine, and then your pancreas and your small intestine produce a little bit more of that amylase to finish the digestive process of the starch in your small intestines. So it's in the wrong place. Yeah, you know, it's there, but that's where it's supposed to be. But when you eat it with a protein, the protein slows it up in the stomach, so it can't move. It must stay and wait for the protein to digest. So if the protein takes 12 hours, the starch is going to take 12 hours in your stomach. After the protein digests, it's going to move, but it moves undigested because it causes fermentation. Because of the length of time it takes. So this is why we have acid reflux, smelly stool, and formaldehyde, ketol in the large bowel, because the food is moving too slow. We call it slow transit time. So you get all this. You go to the bathroom and have a bowel movement. You got to spray the bathroom. I don't have to do that because I don't mix the food the wrong way. Well, I notice as I eat more and more greens and less starches and so on, my feces don't smell as bad. Exactly, because you have fast transit time. So the key is to have the food moving from the stomach into the small intestine. Because remember that the part of the digestive system is the stomach processing, the pancreas, which is the most active gland in the digestive system, that breaks all the foods down. starches, protein, and fats.
Right.
And then after you finish that, you go into the small intestines to absorb all the nutrients from the foods, send it to the portal vessel, into the liver. And then whatever the small intestine don't want, he sends it to the garbage collector, which is the large intestines.
Right.
See what I'm saying? So they work together. I call it the earth system. So these 4 parts of the body is called the earth. The stomach, the pancreas, the small, and the large intestines is the earth. And all the other organs depend on them. So the liver is wood. Wood comes from the earth.
Well, right.
The kidney is water. Water comes from the earth.
From the earth. Right.
The heart is fire. Fire comes from the earth. And the lung is
Volcano.
metal. There you go. And the lung is metal. Metal comes from the earth.
Again, volcano.
You see what I'm saying?
Yeah.
So if the earth is not working properly, the digestive system, that is, the other organs
So,
won't
okay,
work
part of
well.
the earth, your teeth.
Mm-hmm.
I told my brother recently, he called me up and he's looking for a dentist. I said, you don't have to take off your teeth anymore.
No.
I said, like, after I extracted my last set of teeth, and then I remember, wait a second, I have golden seal in my cabinet, and more.
And more.
And I mixed them and then my gum started hurting, so then I pinch off each one of them and I rub on the gum.
Clove oil too.
And as a result of doing that, I was able to heal my gum with using the golden seal
And the myrrh.
and the myrrh.
Yeah.
And I said, damn, I didn't have to extract my teeth.
No.
So then when he called me the other day, I said, bro, you don't have to go extract. Get some golden seal and more and rub the gum. As soon as the gum start, irritating and you start feeling pain, do that. And it's like, hey, bro, I need a dentist. I'm 60 years old. I need a dentist. I said, no, you don't. No, you don't.
All the cures are found in nature.
Let me put a plug in here. We are at Ambrosia Health Foods. Yes? And I want you to come in and ask for Ashanti when you come.
Yeah.
They have all the herbs that we're talking about here tonight, right?
Everything.
Everything. And Ashanti is the son of Roland. I mean, I did not know Ashanti was as knowledgeable as Roland is. And I found out later on that, and by accident, because I went to the other store when you were across the street, and that's when I said, wait a second, that your father is? He said, yeah, that's. I said, really? And from then the respect. So I just want to say to you folks, the phone number is 718-469-0985. 469-0985. 3306 Church Avenue between
New York Avenue and 34th
Street.
Yeah.
Ambrosia Health Foods. You can't miss us.
No,
you can't miss them. You can't miss them. Prostate cancer. I mean, not prostate cancer, but prostate problems, right? And we don't necessarily have to have that. Neither do we have to be, what's the word I'm looking for, suffer as a result of bad eating. It's a matter of correcting our eating and then we should be okay.
Yeah.
Pretty much.
Yeah.
Okay. What can we take to help after 30, and we discover that we are lethargic, we no longer move as quickly, we don't have as much amplification, I guess I'll use that word. What are some of the herbs that we are here at Ambrosia? What are some of the herbs that we can be taking to do that, to fix that?
You mean in general or just for men?
For men, particularly men.
Right. Well, there's a plant called saw palmetto.
Saw palmetto.
I'm going to always promote that particular plant. It's not only a man herb, because in the herbal kingdom, you're going to hear they say, saw palmetto is a prostate herb, and danqui is a woman's herb, and St. John's wort is the depression herb. But that's not true, because although we use saw palmetto for the prostate, it is also good for the immune system. It is also good for the lung. To build the immune system. Yeah. It is also good for women who have fibroids and want to prevent the fibroids from getting bigger. It stops that. So it's not only a man plant, but it has a lot of testosterols. The significance of that particular plant is it prevents our hormone called testosterone from converting into high dihydrotestosterone, which is the culprit of prostate cancer in us men. So all men should take that particular plant regularly.
Okay, I want to take the plant. Is there a way to do that? How do you?
Well, plants come in different forms and in different categories. So you have the powders, and you have the roots, which have to be boiled. Then you have the leaves and the flower that floats, and they have to be infused or steamed. So if you're going to buy it in the root form or the berry form, you can crush it up, and you can use a teaspoon to a cup of hot water. That's in the herb form. It's come in a tincture form also. You can take 40 drops 3 times per day in some juice or some water or some tea. And then they come in the capsules where it is standardized to maybe say 75 or 85% sterols to keep the prostate healthy. And then you just take accordingly the directions on the bottles. So there are different forms of it. You know?
How come you know so much about herbs? I know you told me that you got serious when you had your stroke.
Yeah, I studied it. I want to study it. I went to school for it. Yeah.
Okay.
Yeah.
And so somebody who is interested.
A very good school, what I did was, there is a school called Pacific Institute of Oriental Medicine. So you do Chinese, because I was very enthusiastic in Chinese medicine too. Because I was dealing with a doctor called Dr. Wu, who was doing all these traditional stuff with needles and cupping. That's where I learned it from, cupping and needles.
Right.
And also mox buction, where we could eat and move the pain. And that I got interested in that. And when he repaired when he took me off the drugs that I was on for high blood pressure after my stroke, then I became interested in that type of medicine too. So I combined them together. So I combined the Chinese medicine with the Western medicine, the African medicine, and the Caribbean medicine.
But people are always challenging people like yourself.
I don't believe in challenges, man.
Well, I'm saying they will always, who tell Patrick,
yeah, well, you know, the key is to look at the results of the sickness. And we have people who, look, we just had a sister from Grenada who don't have cancer anymore. She's cancer free.
Well, I mean, that takes me, that's the segue that takes me to the, how much were you saying, 30 women that you got pregnant?
32.
32 women that we
helped to get pregnant.
We want to be clear about that. What's your shadow?
Rafika was one of the first persons, is my very good friend. She came in Roland and had a story. Roland and I know each other from long, since about 1984. I know Roland. I know Roland before he had the store. And then Roland and I, she was my friend, and we bought her here, and she have one son now called Sadat. You know what I mean? Because she couldn't get pregnant. And so what we do is we put women on programs. So I have a program called For Women Only. And if the woman can't get pregnant, because some women have polyps, and that will prevent them from getting pregnant. And then they have to go to do surgery to remove the polyps. Then they can. Then some women have blocked tubes. You know what I mean? Where the tubes are blocked with mucus. That also can be repaired by using what we call uterine tonics that help with uterine circulation to move the blood and clean up the tubes. Some women have hormonal problems where they're in balance. So we have to go in and balance back the inner ecology of the reproductive system. That's another way of helping too. And then some women have PCOS. It's called polycystic ovarian syndrome. And that condition don't prevent pregnancy, but it can make pregnancy become more difficult. See? So those are things we look at, and then we have look at if the follicle is maturing. You have to look at all that. You have 5, you have 6 follicles, that's okay. But the follicles have to mature. So we use herbs in that aspect to help the follicles or to remove the growths in the uterus or the ovaries by putting the woman on a program to follow for 45 days. And in that 45 days, she can't use anything that's unnatural. Everything has to be from the earth. And even the shower filter, she must put a shower filter in her shower to avoid chlorine into her pores.
To avoid the water?
The chlorine in the water.
Chlorine in the water,
yeah.
Right.
She can't use no spray. She can't use no lipstick that have a lot of chemicals. Everything has to be natural. And in that way, we balance back the woman's internal ecology of the reproductive system.
And then it clicks.
If the man's sperm count is good.
I was about to say, you the man have no sperm.
Yeah, because sometimes the woman resists the man's sperm count, the man's sperm.
Right.
Because remember, the woman's vagina have a pH of 4.6, very acidic.
Right.
But a lot of the times, if the sperm don't have enough enzymes, when the sperm go in, the woman's pH in the vagina kill the sperm. So if that happens, we ask the man to wear a condom for 1 month while we feed him enzymes. And the enzymes will resist the pH in the vagina, helping the sperm to go in.
And what kind of enzymes?
Well, digestive enzymes,
okay,
or proteolytic enzymes, and that will help the sperm to move in, and the pH in the vagina don't kill the sperm then.
Okay. Every time I talk to you, you know, there comes that point in the interview where I get totally flabbergasted. But anyway, it has to. We have to move on.
God is good.
God is good all the time, partner.
Yeah.
You are, I mean, without words, I mean, one of the best people that I know. There are a few people who I listen to as well. There's Dr. Batson, auto trainer, very knowledgeable guy.
Yeah.
Then I have a friend out in Tennessee. I mentioned her to you the other day. She's a trained medical doctor, but she practices primarily herbal medicine,
okay,
and treats her patients from a holistic point of view. So she's not totally medical on the Western side.
Okay.
You know, she's one of the smart ones, and I have to give her credit. So we're talking about the women or the men not being able to procreate or have sex optimally after 30 years old,
right,
without being careful.
Right.
Does the woman have a similar situation?
When she passed the age of 50.
After 50?
Yeah, because her estrogen level drops. You see, us men have progesterone,
right,
testosterone, and that's our sex helper.
Right.
The woman's sex helper is her estrogen.
Right.
So hers drop when she menopause. So she don't feel for sex. Because that's what make her have, when she's young, she's estrogen dominant. She's all, same thing with the men, testosterone. Once we pass the age of 40, that starts dropping also.
Right.
So we have to look at the numbers, because testosterone can also convert and cause us men to get cancer in the prostate gland.
Oh.
So we must check to see the numbers. If the numbers are low, we could push it back up by using testosterone RX, or Ambrosia have some stuff that deals with testosterone building. But you must take a test first to look at the numbers. Otherwise, you can get cancer in the prostate from too much testosterone that can convert.
And the woman with her estrogen dropping, is that a bad thing, or is that a...
Well, the man going to get problem, because when she want to ask the man, she have another guy outside.
So, okay. So that's a good one. How do you educate the men that age and timing, can I use that, are the two factors that will cause her to no longer have interest? Well,
to be honest with you, a lot of the younger women have the same problem too. And I don't know if they're, a lot of times it's progesterone cream that they need, to have a balance, because progesterone is like a woman's protector from cancer and from other troubles in the reproductive system of the woman. See? So sometimes that is the problem there in terms of the hormones. So a lot of the time when the woman, don't want to have sex because they don't feel for it. And that's hormonal too. Or stress could cause it too. Because we're living in a stressful society, Yeah. A lot of the time the man, because a lot of us men doesn't understand the woman's body. We don't learn about it. So we seem to don't understand why she don't want to have sex for the whole week. And we in the mind thinking, oh, she got another man outside. It don't have to be that. It is just that she's going through a change. Or she have PMS, premenstrual syndrome, where her mood is all messed up because her liver is all stagnated. Because the liver could cause a woman to have PMS. Because the liver manufactures them and breaks down and excrete hormones. If the liver don't do that because she have what we call a stagnated liver, that can also cause a woman to have troubles with feelings for sex. And that's what we men doesn't understand. unless you're in my profession, and you could, you could talk to the lady and ask her, how you feel, why you not feeling for sex, and she will tell you, and then you have to put two and two together, and make her better, make her feel better, or do something that will help to enhance her sexual drive. So that's what we do. That's what they call us herbalists.
But then sometimes she gets the sexual drive and then she's gone and he's standing there like like a lightning, and then
well, we don't want to get too stimulated though.
No, what I'm saying, but we know that happens, right?
You see, I'm gonna tell you something that a lot of men have. Lots of women doesn't have an orgasm.
Most times, that's
lots of them.
A lot of time.
Yeah.
Yes.
And that's because lots of men train them wrong.
Train them wrong.
Train them wrong.
Okay.
I want to use the word train wrong.
Okay.
Because if you have a lady or your wife or your girlfriend, whatever it is, and lots of the time she's not having an orgasm, you have to find out why she's not having an orgasm. But a lot of people deal with oral sex now. And that's the way lots of women do have one. So we train her or we spoil her in that aspect. So if we don't have, or if we don't do oral sex, she don't have an orgasm. Because that's how we taught her.
Uh-huh.
You see, that's one of the problems that a lot of couples have. Another problem again is we men, we can just go on a woman and just ride.
Boom, 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 yeah.
And she said, and we say, oh, and we have a ejaculation.
Right.
And she says, what's going on, man?
And yes.
2 minutes, be done.
And yes, 10 seconds.
And she's not satisfied. You see what I'm saying? Right. You see what I'm saying? She didn't warm up yet.
Yeah.
And that's because we don't learn about our woman's body. That's one. And number two is, again, some women do not have or cannot get an orgasm when the man is on top. Some women have to come up on top to have an orgasm.
Right.
Some women have to lay on the side to have an orgasm.
Right.
You know what I mean? Some women have to do, some of them have to pull their hair. Right. Some of them is freaky,
Yeah.
Different people, different strokes. But if you...
Yeah, don't tie up some of them.
You understand? But if you can ask a woman, and a lot of us men don't do that because we feel with a macho guy, we just going to do it. Lots of us don't ask a woman what makes her feel good.
Right.
So when we in a spot, the woman might say, okay, I want you to stay right there for me. Because in that spot, she can have an orgasm. If we move, we throw her off balance.
She's telling me, well, there's a friend of mine and she used to tell me, stay right there.
Right.
Move, don't move.
Right, exactly. And that's the key.
Because when I moved, then she said, man, you're killing the sugar.
You're killing the sugar.
You're killing the sugar.
Right, you see? Because that's her G-spot right there, you see? But because we feel we can just go in and just bang and bang and bang, and we don't ask the woman what makes her feel good, then she don't have an orgasm. And then she become very, some of them just don't want to have sex anymore.
Just go ahead and finish yourself and leave me alone.
Yeah, you don't bother. They just want to satisfy the man.
Let me take you around the corner now. Women who are but post, not orgasm, what do you call the thing when they
menopause.
Menopause.
Mm-hmm.
And I have a few friends who, Patrick, they call me. Mm-hmm. They don't know your number, so they call me. And I'm able to, little knowledge that I have would say certain things to them. Put it out here now, and for those who are watching and they can share with their friends, a woman going through menopause, how could she face that and, deal with it? The sweats, the cold sweats,
the hot flashes.
Hot flashes.
Yeah. Women have to prepare for menopause because lots of women can go through menopause without having symptoms. The Asian woman does. And hardly Chinese women and hardly Japanese women go through symptoms of menopause because they use a lot of soy, but not the regular soy. They use the fermented soy.
So fermentation of food is good?
Very significant. You see, because...
And that is fermentation of food outside of the body, not in the body.
Right. If you're looking at Misco and you're looking at tempeh, they're soy products. But they're fermented. So when they're fermented, they bring out all the chemicals the phytonutrients, plant source that is, to help a woman. And they also prevent angiogenesis in cancer. So they don't make the cancer cells create more blood vessels to feed. That's studies. See what I'm saying? That's science. Yeah. So with the woman in the West, when she don't prepare for menopause. So when menopause comes, it hit off balance because her estrogen level drops. You see? And when the estrogen level drops, the progesterone drops too. So she gets hot flashes, she gets skin crawling, she gets anxiety, she gets some women get arthritis.
Yeah.
Some women get, like my sister had mental problems. You see? So different women have different symptoms. So there are a few herbs that we use to help women to go through that phase of life, that change of life, without going through the symptoms. So we're looking at an herb called Mother's Wort. It's what you call an Inorganic plant.
We have one?
Yeah, you get some Mother's Wort for me? Mother's Wort is a wonderful herb for women, blue vervain.
I know about blue vervain.
Another herb we use again is called Dankui. And one of the most important ones is called chaste tree. This is Mother's Wort right here. Another herb called chaste tree. What chaste tree does, it works on a gland in the brain called the pituitary gland. And because the pituitary have to get a signal from the hypothalamus, the pituitary, when it gets that signal from the hypothalamus, it helps to normalize a woman's luteinizing hormone and her follicle stimulating hormone, FSH. Once these both hormones are balanced, her estrogen and her progesterone now is balanced. So she started going through a system-free menopause.
How long menopause supposed to last?
Well, some women last 6 months, some women last for 5 years. It's according to the woman's ecology. So what we do is we use these herbs, but we also give the woman a progesterone cream and an estrogen cream to rub on her breasts. 3 days on the breast, 3 days around the navel, 3 days on the inner thigh. Both of them, because they have to be balanced. While we're giving her the chaste tree to normalize her LH and her FSH from the pituitary gland. And then we're giving her herbs now. Cucumbers are good for hot flashes. Celery is good for hot flashes.
Right.
Parsley juice, celery juice, and cucumber juice, yeah, they're very good for hot flashes because they cool the blood. Because the hot flashes come from when the blood is heated from the nerves. See, the nerves get heated and send that heat into the blood. And the woman have that hot flashes because in the blood, see? So with the cucumbers and the celery and the parsley, they cool the blood down. So she don't get hot flashes.
Chamomile tea?
Chamomile is more for when you have troubles in the nerves or in the endocrine system or the stomach, because the stomach have nerves too.
Right.
And she have trouble, she can't sleep because of menopause.
Right.
If she have what we call repetitious thinking, meaning that she's going through menopause and she's in the bed and her mind is going all over the place,
right.
we give her passion flower with chamomile.
Okay.
So you have to know what, because a woman who's going through menopause can get insomnia too. So you have to know what is causing the insomnia, and if it's repetitious thinking, then you have to know what herbs to give her. Because some herbs don't work if you have repetitious thinking, you see? Yeah?
So ladies, I'm trying to get some help for you guys, you know, and hopefully that we could have some help. Patrick Delves can be reached for the next couple of days. He's in Brooklyn. You can find him here at Ambrosia, but you have to call and make an appointment.
Yeah.
Right? Because he stays busy. Trying to call him on the phone and talk to him directly, not a good idea. So Ambrosia again is at 3306
Church Avenue,
yeah, between New York and 34th Street.
Yeah.
I encourage you to please make a time and come in here and have a conversation with him.
Right. So Ambrosia have a formula called Woman Transition Compound, and it transforms a woman ecology when she's going through menopause, so she don't get that symptoms from menopause. And then we have another one that will help with lubrication in the woman, because when the woman is going through menopause,
that's right,
she gets what you call vaginal dryness.
Right.
And then these herbs like blue vervain and sea moss and flax oil, they will help to lubricate. Even oatmeal also. Is the woman could boil some oatmeal with some flaxseed meal, and she can drink that. That will help, or some sea moss gel. That will also help her to lubricate, because the ovaries now is going to start producing her, not androgens.
Well, let me take you up on sea moss. Well, because we grow up with sea moss as a we get some sea moss, we boil it, we make some porridge, and we're saying, well, strong back, and that's good for the back, and we take Tanya log, and we make a Tanya porridge,
Starch,
and
with milk
and all that kind of stuff. We wasting the sea moss is what you're telling me.
Well, I wouldn't say we wasting the sea moss, because we were not educated on how to use the sea moss.
Okay.
So if you have it in a gel form, like Ambrosia have it in, like Ashanti have it in a gel form, wonderful, because what they did was different than other people is they put cinnamon, cloves, ginger.
They season it.
They season it, yeah. Very effective.
Right.
So it not only lubricate the vagina, it also lubricate the lung, and it also prevents trouble in the stomach in terms of ulcers, because it becomes demulcent that way in the gel form.
Right.
But in the raw form, you have to blend it. Or what I do is I put it in soup, and I eat it as a noodle. So instead of putting macaroni in my soup, I put sweet moss in my soup. 2 minutes before the soup is finished, so I eat it as a noodle, and I get the nutrient from that, because it's good for the bones. Yeah.
Right.
If I blend it in a blender with coconut water and different stuff to give it a taste, then I get in all the 92 minerals and trace elements that the sea moss have.
And we have, talking as a Grenadian, we have sea moss in abundance.
We have the best sea moss in the Caribbean.
And we have the best sea moss.
Yeah.
That's what a few people have been telling me, that
yeah.
Grenada has the best sea moss that you can get.
Yeah.
Okay. God have mercy. This time is against us. But anyway, I'm prodding through here. Breast cancer. And we have women who have lost the breast. I have a friend who they just cut off both of her breasts. She had the cancer a couple of years ago. They got rid of it. Well, it supposedly got rid of it. Then it came back.
Yeah, must come back.
And then, so now, and it came back in one breast. And so she said, well, might as well cut off the other breast, because that means it could come back there as well.
She know better.
And so she cut them both off.
She doesn't know better.
She don't know better.
Because cutting off a part of the body that have the cancer don't fix the cancer. The cancer is still there. That's the problem with the medical system. You have trouble in your gallbladder, they pull it out. A surgeon is a great man. See? He's a great man, because I can take out the tumor in your brain. See what I'm saying? That he can do that. But he cannot prevent the tumor from coming back. He doesn't know how. You see what I'm saying? So when you have breast cancer, what they were taught in medical school is to remove the breast. But the cancer is still there. You have to find out what is causing, or what caused the woman to have breast cancer in the first place. Got the different types. The BRCA gene. And the BRCA gene is not bad. That's what they make you believe as a woman, but it's not true. The BRCA gene is your protector. But if you have what we call a BRCA junk gene, meaning that you're eating a food that is bad, and you turn that gene into a junk gene, you can get breast cancer from the BRCA1 and BRCA2 gene.
Opening yourself up.
Exactly. Then you have the ER1 breast cancer. It's called ER, meaning you have the estrogen receptor breast cancer, or PR, progesterone receptor breast cancer. And then you have the triple negative breast cancer, which is not hormonal at all. Then you have the DCIS, ductal carcinoma in situ. So you have to know what is causing the cancer in the woman's breast. Brass straps is one of them.
And the metal in the brassiere.
Yes. The woman should never wear bras in the house. Period. When you get home, take your bra off. Because the bra straps remove or stop the blood from moving properly. That's one cause. The second cause is estrogen dominance. So that's what doctors should look at before taking off a woman's breast. That's why they give you tamoxifen after you have breast cancer from hormones. So the tamoxifen prevents the estrogen from invading the receptors. That's good, but they give you a 5-year survival rate with that particular drug. After 5 years, you got to come up because they give you uterine cancer. You see what I'm saying? So they give you these drugs, or they take your breasts off, and they look and see if the cancer is in the lymph nodes. Because once the cancer moves from the breast, if the cancer is in the nipple, they call it DCIS, ductal carcinoma in situ. If it's in the lobule of the breast, it could move into the lymph nodes faster. And when they get into the lymph node, because the lymph system is fluid and vessels that flow parallel to the bloodstream, intra and ultra, it moves the cells into the lung or into the chest cavity. So what they do is they remove 15 nodes, 20 nodes in the woman's arm, in the woman's nodes, in the woman's lymphatic system. What it does is, because it is fluid and vessels that flow parallel to the blood, when the nodes are gone, the woman's having what you call lymphedema, swelling of the arm. Okay. Because the water can't flow.
Right.
See? And then they cut the breast off and they give her either chemotherapy or radiation.
And then those things do some other damages.
Well, the radiation causes secondary cancers. That's the reason why they said to us, do not go and stand in front of a microwave oven.
Well, I'm trying to get everybody to throw the microwave oven in the garbage.
That's why they said to us, do not take too much X-rays because of radiation. So if we're not supposed to do these things on a regular basis, why are you giving us radiation for cancer? And it could cause secondary cancer. So you could move the cancer from the breast and send it into the shoulders, or in your spine, or in your bones. You see what I'm saying?
So, okay, after you remove the breast, they remove the breast in Hawkins.
Mm-hmm.
2 of them I know, 2 of them.
Mm-hmm.
What can they do to, I would say, fix, or is it fixable at that point?
Well, according to what stage the cancer is at. Remember that your breast is not an organ.
Right.
I'm trying to educate women about that because we just have a patient who put up a post on my page. She's cancer-free from breast cancer. She didn't take it off. She followed a protocol for 2 years, and she's cancer-free. No cancer in the breast anymore.
Right.
Because what we did was we attacked the cause of the cancer and put on a program. You see what I'm saying? Mm-hmm. So the key is to, after you remove the breast, you have to find out what stage the cancer is at. Stage 1, stage 2, stage 3, stage 4, end stage. So once the cancer moves from the breast, which is not an organ, because if you have cancer in your breast, you can keep the cancer in the breast for 2 years. Once they don't move, it don't harm you. That's reality. They can't do that either. Mm-hmm. That cancer only harms you when it moves into an organ and disrupt the function of that organ.
All right, all right. That's taking us to the other area now. Go ahead.
Then it affects you.
Okay.
See, once we can leave it in the breast, what we do is we do what we call paste. So we could give a woman some paste. You talked about myrrh a while ago. Myrrh, pork root, golden seal, all these herbs, turmeric. And we could make a paste out of these plants in the powder form and rest it on the tumor in the woman's breast. And in a couple of weeks, they put a hole into the breast and the tumor comes out. That's the old way of doing things. You talked about the brush a while ago, right? We do that, and then what we do is we look at the woman's hormone levels. So remember that a woman only gets breast cancer because if it's not triple negative, that is now. Because triple negative is not hormonal. If it's from hormones, we're looking at the receptors, because remember that all hormones are messengers. And all hormones have a receptor that receives the messages from these hormones. So estrogen is a messenger. It's a hormone, but it's a messenger. And that's the reason why they give them tamoxifen. So what the estrogen does, synthetic one, not the natural one that God put in the system, that don't give them no cancer. The one that comes from cheese and eggs and milk and meat and fish and all these foods.
Right.
And soy. Not the fermented soy. All these foods that stacks up against a woman, they're synthetic. So what they do is, doctors don't teach them that, these synthetic hormones go in and they steal the woman's combination lock to her receptors. The difference in the natural and the unnatural estrogen is when the synthetic gets into the receptors, he tells the tissues to keep on producing at an alarming rate. He don't know when to stop. You see what I'm saying? And then the natural one don't do that. So that's the reason, that's what we look at. We look at also the pituitary gland. We look at how the woman's pituitary function. That's significant. You understand, to hamper breast cancer. So we have to look at the synthetic hormone or the natural hormone, estrogen, and prevent the estrogen from going into receptors and causing the receptors to keep on producing these cells. Number 2, prolactin levels. The higher prolactin level in a woman, the more prone she's going to get breast cancer. Produced by the pituitary. Prolactin levels. So what we do is we help the liver to excrete or break down estrone, which is the culprit for breast cancer in women and ovarian cancer in women. We help the liver to break down the more dangerous estrogen called estrone into the most least effective one called estriol. The liver is important in cancer health or cancer treatment. And once the liver could break down the estrone into estriol, then the estriol is excreted via your bowels.
And you pass it out.
And you pass it out. If you keep on having constipation, and you have what we call recycling estrogen coming back into the portal vessel, everything starts growing again. And that's what they don't teach women.
Well, one of the things that I learned from Roland a long time ago, and that one, the first time I heard him tell me that, I freaked out in terms of the organs, not the organs, but the removal of the appendix.
Terrible.
And I never, up to that conversation, I never ever thought of the appendix as anything of importance. And then he explained to me, well, God made a mistake when he left it there, didn't he? And God don't make any mistakes.
The appendix is a security guard.
It's a security guard.
Yeah.
And I learned that that the appendix, well, let you explain it. The function of the appendix.
Right around the appendix is called a cecum. It's a lot of worms form. And I want to mention this. Lots of people who eat tomatoes should remove the seeds.
The tomato seed?
Yeah, because a lot of people who have appendicitis, tomato seeds was found in the appendix. Clog it up and give them appendicitis. Guava seeds have the same problem too. So if you're going to eat tomatoes, make sure that you remove the seeds or lightly steam the tomatoes. Don't eat them raw. Because the seeds can cause you to get appendicitis too.
Wow.
But the appendix is like a watchman on a tower. And his job is to look at what's coming back from the descendant colon to go back into the ileocecal valve, into the small intestines. So if you want to go to the bathroom and you lose the urge because you don't want to go outside to use somebody else's bathroom, and you lose the urge to go to the bathroom, that waste product start coming back down from the descendant to go back into the ileocecal valve, and your appendix is saying, don't come back, man, don't come back. Because you're supposed to go up into the splenic flexure or the hepatic flexure and go across into the transverse, into the splenic flexure, down into the descendant colon. But you're coming back. So he's watching, the appendix that is, and says, oh, don't come back. And you lose the urge, and it starts coming back, and then the appendix says, oh, shoot. He starts shooting a fluid that is poisonous to neutralize the waste that is coming back.
Right.
That's good, but he kills you eventually.
Yes. That's what I learned. That's what I learned.
56% of people who lost their appendix came down with colon cancer because it is part of the immune system.
And it's not functioning as it should.
No.
It's not. Patrick, I need 2 days. I need 2 days. I need to talk to you for 2 days. Because we're just scratching the surface.
No, this is power,
I want to make another point here and make sure that, all of what Patrick is telling us here, all those herbs that he's talking about, you can come to Ambrosia Health Foods on Church Avenue and
the beautiful thing about Ambrosia, they have everything in formulas. I don't believe in single herbs. They take too long to work.
Okay.
So I believe in combination of plants. So 7 plants together, 8 plants, they all do different things. You're supposed to have the main herb, the supporting herb, and the assistant herb.
Okay. We're running over time right now.
Yes, sir.
And I know, I mean, a lot of mercy. Thank you so very much, boss. I hope you're not in trouble for staying out too late.
Ashanti, my brother from another mother.
I will call and I could give you a note.
We talked already. We talked already.
To let her know you're late tonight. But no, okay, let's touch on high blood. We talked on high blood pressure a little bit. Before, but I want to go into it a little bit more. Why are so many of us having high blood pressure, hypertension? Well, we call it sugar.
Diabetes.
Mm-hmm. Why so many of us have those ailments?
Eating wrong.
Eating wrong food.
And the doctor's going to come and tell us it's in your genes. That's not true. It is what we call a genetic predisposition, meaning that if you eat the same foods that your mother and father have been eating, and they have a problem, you're going to get it too. You see what I'm saying? So for instance, husband and wife. Husband and wife have 3 children. Mother teaches daughter how to cook. Yeah? Husband have high blood pressure. Are you following me, brother?
I'm with you.
Right.
I'm a little bit.
Husband have high blood pressure. Mother teaching daughter how to cook. Daughter get older, married to her husband, and feeds her husband the same way her mother been feeding her father, and the daughter's husband come down with high blood pressure the same way too.
Because they're following the same diet.
Yeah.
Practice.
Yeah. If you implement another man's diet, you are going to get the man's disease.
Right.
So we were taught by Dr. Michael Tierra that you have to eat the food in your environment or eat the food that you grow because it corresponds to your bloodstream.
This is what at the top of the program, this is what I was talking about in terms of changing our diet, trying to eat like the Europeans. And so then they feed us the medicine that they're familiar with.
Right.
That one size fits all.
Right. So for instance, if an African man leave Africa and comes into America and incorporates the American diet, he gets prostate cancer faster.
Quicker.
Yeah.
And while in Africa, it's not the same thing.
It's unheard of.
Because it's a different
different kind of diet.
Different lifestyle.
Yeah, because the food's supposed to
dietary.
correspond to your bloodstream. So you can get high blood pressure from different places. You can get high blood pressure from coronary artery disease, where the arteries are very weak, the vessels are weak, and the heart has to pump the blood to the vessel walls. And because the vessels are so weak, it can't handle the pressure from the heart muscle. You can get high blood pressure from that. Yeah? You can get high blood pressure from the lung, called pulmonary hypertension. You can get high blood pressure from your kidney, because the kidney produces renin that helps to normalize your high blood pressure. You can get high blood pressure from the adrenals on top of your kidney. You can get high blood pressure from the liver, from the gallbladder, because there are meridians that flow from these areas to the heart muscle. So once you can tell where your pressure is coming from, you can repair high blood pressure like I did. So we put people on programs. We have a high blood pressure program we put people on. Say, okay, sodium, leave sodium alone.
Salt.
Salt goes down and in, sugar goes up and out. Sugar goes up and out.
Say it again.
Sugar goes up and out. Salt goes down and in.
So, okay. Slow down. The night is young. The night is waiting. It's not young. The night is not young. The night is not young. But I have questions here from the chat as well. Bob Marisho, I see you. Salt goes down
and in.
And in.
Yeah.
Break that down.
When you eat a lot of salt, if there's sodium chloride from the shake on your table, terrible. Not only
salt to your food.
Right, to the food. Lots of salt, sodium. We are only allowed to have 400 milligrams of sodium per day. 400 milligrams. The average person in the Caribbean and in North America takes in 5,000 milligrams per day. And it is the inorganic sodium, salt. So it goes down into the joints, eat up the joints long term, you get arthritis. That's one cause. Number two, it clogs up the veins, you get varicose veins, clog up the arteries, you get hypertension.
So that's where we get it from.
Yeah, because sodium and potassium works together, you know, one in and one out of the plasma. So if the sodium cannot move out of the system because it is inorganic, it goes down and it don't come out. Whereby sugar supposed to be burnt as fuel, so we're supposed to burn it up as fuel. That's so it goes up and out. Sugar, that is.
But that is if we are active.
There you go.
We have to be.
That's why we should be using sugars in the morning or in the night time. You see what I'm saying? Never eat fruits in the morning, don't eat fruits at night either, period.
Fruits in the morning, no.
No. Fruits at night, no.
No.
No. Temperature is cool.
Fruits in the middle of the day.
Fruit should be eaten when the temperature is hot, so you can burn the sugar up and make it go up and out as fuel. So if you don't have enough sugar in the brain, what happens?
Headache.
No. You faint.
Okay.
You pass out. Yeah. Because the body's so wise, the body puts you at the horizontal.
Tell you to sleep. Put you to sleep.
Yeah, put some sugar to come back up again.
Right.
So sugar it goes up and out. So and salt go down and in. So you have to know what salt you're using. So celery have sodium chloride. But celery have lots of organic sodium chloride. So when you use celery, you get the salt or the sodium, but it moves out of the plasma. It don't stay in and cause you to have trouble in the arteries.
Okay, back in the day, or when I used to cook, I would not season my food with salt. But I would season, when I season the fish especially, fish, because I hardly ever cook meat, I would bring lemon. That would be my tool, or my seasoner. When I put all the other seasoning and so on, I squirt the lemon over that fish, and then I broil it.
Right.
Right? And every time that people who say they don't like fish, taste the fish, I have to fight, and give them a little taste. I have to fight them back from the bowl. Because they like the flavor that the lemon brings to it.
Yeah, lemon is significant.
Because I said is my
Any
salt.
juice I put lemon in there. Squeeze the lemon. It's a boss.
Okay.
Keep the body alkaline too.
Bob Morris is asking a question here. He says, what is the effect of the pituitary gland on the thyroid gland? On the thyroid gland.
Well, the pituitary produces a hormone called TSH, thyroid stimulating hormone, and that feeds the thyroid. So when a doctor takes a thyroid test for you, he take a TSH test, he take a T3, thyroxine 3, and thyroxine 4. So the TSH is produced in the pituitary, and the pituitary feeds the thyroid. The pituitary is very significant, you know. It's a gland that feeds all the other glands, including the thyroid gland. So your pituitary feeds your testicles and the ovaries. Your pituitary feeds your pancreas for insulin production in the endocrine part of the gland. Your pituitary also feeds your adrenals. And your pituitary also deals with your kidney in terms of the water balance. So it is significant. So it produces that TSH, thyroid stimulating hormone, to feed the thyroid. And then the thyroid now have to, because there are 4 glands around the neck called the parathyroid, and they do 2 things. They produce what we call PTH, parathyroid hormone, and it metabolizes calcium and the B complex. So when you have kidney stones, because your parathyroid is messed up. You see? So because all the glands work together, they call them endocrine glands. So they work together, they feed each other, but they all need sustenance from the earth system, which is the digestive system.
And
you have to have...
And going back from the mouth.
Exactly. You have to have everything in balance from the digestive system, because without good digestive health, your endocrine system will never work well.
Well, the digestive health has to be good, as well as your stomach.
Well, the stomach is the digestive system. It's the earth.
Well, but not the stomach. I'm saying stomach meaning the waste going out.
Right, with the large intestine. You have to go to the waste, yeah.
Intestinal health.
Right, you see a lot of herbalists said that death and life starts in the colon. I don't say that.
Okay.
I said death and life begins in the digestive system.
Okay.
The colon, because the colon is only part of it. That's a sewage system. That's only call it garbage.
All right. Let's go. Yeah? Let's go to this level here. We talk about the high blood pressure, the hypertension, the sugar, and so on and so forth. Patrick Delves. Lupus.
Lupus. Autoimmune disease.
People have lupus and they tell them there's no cure. There's no healing. There's no, you're going to die, you eventually going to die with lupus.
So how come we have people who doesn't have lupus again? Look the brother right here. How come we have people who came here and don't have RA, rheumatoid arthritis? We have them in testimonials. Lupus, you see, I told you before that.
Stick up in right here. I want to do another program, and I know I'm putting it in your lap and as well as in your lap, with some of those testimonials.
Yes, definitely.
Where we could bring in a few people.
Yeah, I could call them.
Right? And then we could do a sit-down like this. But anyway, I would like to do a program.
We can do that.
With those folk who have gotten help from you over time.
All in Trinidad.
Wherever they are.
All in Trinidad, all over the place.
And nowadays technology could bring you from anywhere.
Anyway, now lupus, remember that we said before that to a doctor, the regular doctor out there's no cure for anything.
Right.
So because he don't know what caused a problem, so he can't find the cure. So if you drive in your vehicle, and your engine light shows up on your dashboard, you take that car to a mechanic. And the mechanic say, John Crow, I see your engine light on the dashboard, but I don't know what causing it. So I'm going to just cut the wire that caused your light to illuminate on your dashboard.
And then turn off the light.
Yeah. But you didn't fix the trouble.
You didn't fix the problem.
No, he didn't find the cause. So because the so-called sick care system, because we're not living in a healthcare system, we are living in a sick care system. They tell you to get sick and come to them. I said don't get sick, prevent it. So because we are living in that kind of system, a doctor was not taught in medical school how to repair a problem. So he don't think out of the box. So when he's in that box, he says, there is no cure for this, there's no cure for that. Because he told me I could not fix my hypertension. They told me I had to take drugs for the rest of my life. Otherwise, I would get another stroke. I had one and never get another one. And I'm 66, yeah? Follow that, yeah? So when a person have lupus, there's two types of it. One is called discoid, and one is called SLE. One attack the tissues, one attack the skin, like a butterfly on the nose, yeah? What caused lupus? I call lupus phospholipid syndrome. Don't forget the word. Phospholipid syndrome. Fats. The organs are bloated with fats and can't function well.
Even in a child?
Even the children too. You know what I mean? Because lots of the time the gut health is bad in lots of people. So if you're going to fix lupus, you must go to the gut first and fix the gut. And then because on a cellular level, because the organs are so bloated with fats, and fat is that acid, it makes the body become acidic on a cellular level. So all the acid get into the cells, and because your cells supposed to bathe in liquid, alkaline liquid that is, once the cells start bathing in these acid liquids, your cells become overzealous, and then they start to attack some part of the body that is weak. So they either attack your skin, they call it lupus or sclerodoma. It attack your muscles, they call it muscular dystrophy. It attack the nerves, they call it muscular MS. Multiple sclerosis. It attack your lung, they call it saccharidosis. It attack your joints, they call it rheumatoid arthritis.
And all of it is because of good food.
Yeah, it attack your eye, they call it Sjögren's syndrome. They have all these names for them, but it's one cause. Acidosis and mucus in the cells. So if your immune system, I want to answer this question for me, if your immune system is so dangerous to kill, attack your kidney, because lupus can kill you, MS can kill you too, because the myelin sheath is all damaged, right? If your immune system is so dangerous to attack you and damage your tissues where they have to give you a steroid to suppress it, if it's so bad and so dangerous and it can kill you and damage your kidney, putting you on dialysis, How come they don't teach us that that immune system can kill a virus?
And I want you to put up, I didn't want to go there yet. I really didn't, but I mean, you're pushing me far. You're pushing me far and fast. I know the 90s, a lot of, we come,
Dig that, man.
we coming around.
You're coming around, man. Don't worry about that.
Coming around. But, okay.
So what we do for lupus?
Lupus.
There is herbs we use that act as amphoterics. Amphoterics mean that if the immune system is overactive, these herbs balance it back. If the immune system is suppressed, these herbs balance it back. We call them amphoterics. So hawthorn leaf and flower is an amphoteric. If the heart is beating too fast, hawthorn loses the heartbeat. If the heartbeat too slow, hawthorn bring back up the heartbeat. So we use herbs for people like lupus patients who have these conditions. So we don't suppress the immune system because we become immune compromised. You can't fight anything. So we go and we use plants like turmeric, Kisanja berry, ashwagandha, licorice, linden flower, shiitake, chaga, turkey tail, maitake, gandaderma, ginseng, and we use them together and we put the woman on a program and say, listen to me now. We're going to go into your cell membranes and we are going to increase the function of your your prostaglandins called PGE1, not PGE2, not PGE3, which cause you who have lupus to get inflammation. And we go into the cell membrane and we feed the cell membranes EFAs. Phospholipid syndrome is lupus. Don't forget I told you that. And then we go in and we feed the cell membranes what is supposed to be fed, and then automatically the cell membranes start producing PGE1. Good circulation, no inflammation. And then we go to the cells and we clean the cells up so we have nutrients going into the cells and waste coming out of the cells.
Strengthening the cell.
Yes, sir. And then we prevent bloating of the organ system like the liver. And after day by day, we keep the people on the steroids because you can't come off like that. So I wean them off daily. I wean them off gradually.
And those who follow your program are the ones that we're going to do the program with.
There you go.
In terms of the testimony.
There you go.
And, okay, 500 questions in my head. I could only ask one at a time. I could only ask one. But the night is going fast. I cannot leave here without acknowledging the fact that you recently had almost life-changing, I would say you almost lost your life. Let me put it in straight English.
Yeah.
You almost lost your life in twice. A car accident one time.
Last week.
Right? And he was terribly beaten up. Right now, the right shoulder, I think is the right shoulder.
Yeah, the tendons and the ligaments and my neck and my shoulder from the accident,
And in addition to that...
I got stitches too, just took it yesterday.
How many?
5 stitches.
5 stitches in the upper lip.
Yeah, it is.
So you can't do nothing too drastic right now. To try to kiss, I'm saying kiss.
No. Yeah.
And you also contracted COVID.
Yeah.
And you also healed yourself from COVID.
Yeah.
Something that I found out recently, and I found it very interesting. In Grenada, because we both are from Grenada, our government, part of the OSCS, part of the Caribbean Basin, were given large sums of money. I read somewhere that the United States gave quite a few $1 million.
100 million.
But you heard 100 million.
Yeah.
I heard
300.
300 million.
Yeah.
Is what I heard. And to fight or to push
the vaccine.
Yeah. We have no children's hospital in Grenada. We have no cancer hospitals in Grenada. We have no recovery, if I would call it a recovery centers for our seniors. Our schools are terrible buildings. Our roads are even more atrocious. We ain't got no $300 million or any $1 million to fix any of those kinds of infrastructure. But we're pushing really hard, asking people to take a vaccine that is still an experiment.
Yeah.
As far as I know.
Well, it's not about the virus, it's about a system. to control people. It's not about the virus.
It's not about the virus.
No, because once you start paying people to take a vaccine, something is wrong.
That is my alarming bells right now.
Yeah, and let me say this though. I am not against vaccines.
Neither am I.
I am for vaccine safety.
Well, I'm for the curiosity side. That I would like to know, why is it that after people are fully vaccinated, they're still dying? And
because it's not some proof.
As those who are not vaccinated are also dying.
Well, man is not perfect.
No.
God is the only perfect person
And we try
that I know.
Okay.
But they're trying to be gods. But they're still not perfect. Because they're all going to die just like all of us. Polio was on the decline before the vaccine was introduced.
Really?
Facts.
Okay.
And what I like about America and Britain is they have everything in statistics and
written.
It's written.
It's right. It's written.
Dr. Starch, who was the inventor of the polio vaccine, his son died from polio, or they call cowpox. Do the research, eh? Polio vaccine was contaminated with a virus called simian 40 virus, SIM for short. Look it up. The monkey have it. So the polio vaccine was contaminated with the serum from the monkey kidney, and the monkey kidney had that virus called simian 40 virus. That is an immunosuppressor to HIV. You want me to go more or what? I can tell you much more, I ain't bothered with that. 3,809 children died from smallpox after 97% of them were vaccinated. Only 9 died when 41% of them were vaccinated. 67% of the people who got the polio vaccine got polio. So all this talk about science and science, I laugh at people because people don't do no research. Grenadians don't read. We're not a reading people. We come and we believe what somebody tells us, and we don't do research. I'm a research person. That's why I don't come on social media and talk crap, because I do my research. You see what I'm saying? Dr. Botch, which is a pro-vaxxer with Bill Gates and Melinda Gates, he told them what's going to happen to people long term. But they don't want to listen. You have scientists who study them also. Until these things that happen as negative, and then they're going to understand. They're pushing it and they're making it so, they call them the vision, like what Hitler did in Germany.
Right.
They call them the vision, like what the American government did in the 60s with black people. Right. Blacks can't go into in the front of the bus. Blacks have to go into a different bathroom, and whites have to go in a different bathroom. That's the vision.
In Long Island.
Exactly, that's the vision.
Right.
So they call them the vision now among the vaccinated and unvaccinated. We all gonna die. And the vaccinated get a virus too. Because Dr. Anthony Fauci, who they following every day, come and said to them, the vaccinated and the unvaccinated have the same amount of virus in the nasopharynx.
As you speak on that, how were you able to build your, not viral load, but your
antibodies? By eating the right foods. Remember that our cells, our B cells and our T cells produces antibodies. That's what they do. If there is a threat to the system internally, that's how it works, you know. So the body is very smart. The body is not stupid. So I don't want somebody to come and tell me they're going to put something in my arm to hack my gene or to hack how my body works. It don't work like that. Because once you start to hack my system, it's going to work out of whack. Long term, not now, long term.
Over time.
Over time. Because the body works in a natural way. Because you're from the earth. That's where you're from. That's where you go when you die. So we.
Ashes to ashes, dust to
dust. Well, the earth don't belong to us. We belong to the earth.
Right.
So what I did was, look at the brother right here. I got infected with a brother from Jamaica who came here, and I was saying, everybody talking about this COVID. He was coughing because he had a mask on though. I took off my mask, and Shanti and everybody was saying, this man is, and he was outside and he was scared. I said, nah, get it. I want to see what it's going to feel. So I was going to Grenada on the 30th of January, and I went to get a test on the 27th in Coney Island Hospital. And Friday they called, and they asked me who, Thomas Debs, date of birth, give them the date of birth. They said, you're positive for COVID. So I laugh. She said, why you laugh? I said, because I just laugh, I don't have no symptom. So they ask you all kind of questions. Do you have short breath? No. You have headaches? No. Can you smell? Yes. Can you taste? Yes. Short breath? No. So they're amazed. But they call you every day. So I had to quarantine. Look at him right there. My brother Ashanti. Ashanti was bringing him my fruits and my vegetables every day and my water. And I was in a room for 10 days.
Locked up.
Locked up. I can't come out because I obey the law. And then on the 10th day, when they keep on calling, they asking me all these questions. I'm saying to them, no, I don't have these symptoms. And they keep on saying, well, what do you do? How old are you? You're 66, 65 at the time. You're 65. You're supposed to be in the hospital on a ventilator. I say, hell no. That's what you want to make people believe. And then they started to give me a little bit more respect, you know, and they call and they laugh with us, and I'll be in the bathroom jumping around and sweating. I said, what you doing? I said, I'm sweating. Then on the 10th day, they called and said to me, now, you are free to go out now. So I asked, I said, oh, I'm free to go out. They said, yes. I said, okay. Do I have to go take another test? No, you don't have to do that. You could go outside in the public now. So wow.
Without a test?
Without a test. So I put my mask on the 10th day, and I go to a place on Nostrand Avenue, where I still go. 2361 Nostrand Avenue, urgent care. And I did another test. It says positive. So I went back into Ashanti's house, and I quarantined again for 3 more days.
Now this is after you got the clearance from the city.
Yeah.
That says you could go outside.
Yeah, I have all the proof. I showed it on my live last night.
And you could, and then you get the clearance.
Yeah, to go out, but I still had it.
And then you.
So I gotta go and spread it.
So in other words, you could. Oh, okay.
You see what I'm saying? Send them the vaccinated, they could spread it too. So none of them fool people, and they're making us feel the unvaccinated is the one that's not true. The vaccinated shed the virus too, because the virus mutates and evolves. Right. Because once you're going to fight a virus, the virus is very smart, you know, viruses are very smart. Once you do something, they say, oh, you're doing something, okay, I'm gonna evolve. And they mutate.
Let me change you.
And that's the reason why they gotta get booster shots. Dig that. When I came back out on the 3rd day again, I went and test again in Long Island. And I said to the doctor, I want to get a rapid test, I want to get a PCR, and I want to get an antibody test. And she looked at me and said, why you want the antibody test? I said, because once I see my antibodies, I will know what's happening if I'm fighting a virus. Rapid test negative, PCR negative, antibody high.
And okay, explain antibodies for those of us who don't know what that is.
Antibodies are like an IgG or a molecule that is produced by the T and B lymphocytes. And what they do is, when a virus comes into the body, IgG, IgA, IgM, IgD, IgE. They're all antibodies. And the IgA is the first one that attacks a virus, because when the virus gets into the nose pharynx, it comes in, it meets IgA. And then it goes into interleukin, it's a whole story, but interleukin and interferon. That's how they get in. If they pass those areas, they get into the system and they try to go into your cells. They try to duplicate your cells now and get into the envelope of your cells. So what happens now with the body's so wise, if it's in peak, if you don't have no underlying troubles, your body starts to produce all these antibodies now. The T cells and the B cells, and they get high. And they say, okay, virus, you come, boom, and they hold him. He can't move. If the virus, have a load that's high, then the immune system comes in and starts to fight the virus. The B cells and the T cells start fighting the virus. Cytotoxic cells, NK cells. If the virus load is high, meaning that the virus is very dangerous and have a high viral load, then the cells say, oh shoot, you were the bad guy. So he calls your T helper cells. The Air Force, we call them.
Okay.
And the Air Force comes in and they start to bomb the ground troops now. Okay. That's the viruses.
Right.
And after the battle...
Without harming your...
No, they can't harm you yet.
No, I'm saying the bombers don't harm you.
No, they're going to the enemy. The body's wise, man.
Okay.
They don't... Anthony Fauci don't teach people these things. They want you to come and take these things because they don't teach people nothing. So when the helper cells come in and they try to attack the virus, they kill the virus. And then when they kill the virus, your T suppressor cells come now. And he says to your immune system, he says, listen, you kill that sucker now, I want you to stop. Because if he don't stop, he will kill you too. They don't teach people that. And that's why people who got over the virus still had symptoms, because the immune system was still firing. He didn't know how to stop.
Right.
You see what I'm saying? Because the T suppressor cells supposed to say, stop. Because if he don't stop, he going to keep on firing. He going to damage your lung. He going to damage your kidney. He going to damage your liver. He going to damage your eyes. He's bad. You see? Now after, hold on, after the suppressor cells tell the cells to stop the battle, because you win the battle, now you kill the virus, your phagocytosis now running into the bloodstream, and they're looking for any cell that is infected with the virus, and it kills it off. After that is done, no viral load, no virus in your system now, your B memory cells come and say, I'm a memorize you guy, so you cannot come back anymore. And that's why they said to you, if you get chickenpox once, you can get it twice, because it is memorized. It might come back as shingles. another strain. But the antibodies are there. So when antibodies are at peak,
it peaks itself. I mean, it raises itself.
Yeah.
Strengthens itself.
Yeah. So when you get a cold today, and you get a cold next month, it's not the same virus. It's a different virus. You see what I'm saying?
At night before I go to bed, and early in the morning when I get up, I would use my wife's hair blower that she dries her hair with, and blow it up my nose. Or peppermint oil.
Yeah.
Yes, I put that in my mask.
Kill it.
Right. But I'm saying, but before I go to bed at night, I blow this hot air up my nose. You know, to clear the nasal areas and the mucus that is built up over between the see and smell, I call it. And then I would do the same thing in the morning. So far, I've not had any signs, God bless or whatever. You've got all the praise.
But I killed it. I killed it. And when I go back and check again, I was going home again, and I check again, it said negative, and the antibody was 250. The antibody is supposed to be 0 to 79, mine was 250. So the doctor,
it's supposed to be
0 to 79.
Right.
Mine was 250. So mine was very high, because I was fighting the virus.
Right.
And I killed it.
Right.
So when I went to get a test done in urgent care, and the doctor came, she said, wow, your antibodies are high. You can't get infected no more. I said, I know that. She said, but you don't need a vaccine, but don't tell anybody that.
Don't tell anybody. You don't need a vaccine, don't tell anybody.
So you see, the misconception that the unvaccinated is who's spreading the virus, that's garbage talk already, because 5,469 people recovered in Grenada.
Yes, the numbers are high. The numbers are high in terms of
recovery.
Right.
So and they use Venven and Blue Vervin and stuff like that. So it's a myth that is spreading, because it's not about the vaccine. It's about a control. And this is not a vaccine. People must understand it's not a vaccine. A vaccine is when you take a strain of a virus and put it into a system, into a vaccine, to make the immune system see what the virus is all about. It's not a virus.
I wish I knew the objective behind it, but I know when you start paying people to do something that your body naturally can and will take care of, it's a lot of questions.
Well, you know, it's the New World Order. And remember that the Bible says, many are called and few shall be chosen. The Bible also says, hold on, it says, broad and spacious is the road leading to destruction, and many are the ones going there, and cramped is the road leading to life, and few are the ones finding it. So a lot of people are just brainwashed. And they believe in all these politicians who, they're not doctors, they're not scientists, so they're mandating you. So I'm saying to them, you cannot tell me, look at the lady in Trinidad. Her husband got vaccinated, and the son got vaccinated. She was not vaccinated. And because he was protecting them, because he was on the outside, she was always home. So he wanted to protect her. He got vaccinated 2 shots. The son got 2 shots. They both got COVID and they both died. And she's still living.
And she never got vaccinated?
Never got vaccinated. Now what do you want to say about that? You see, so it's 2 sides. So I'm saying that people do not discriminate against somebody. Because you can still get it.
Right.
And here what they said to me now, oh, well, if I get it because I'm vaccinated, I won't end up in the hospital and be on a ventilator. 74% of the people in Massachusetts got it and end up in the hospital the same way too. But they don't record these things. They don't come on TV and tell you these things. They don't report it.
It's recorded, but they report it.
You know what I mean? So I don't want to go through that because I'm telling people, listen to me, I don't take nothing that is foreign to my system.
I don't want to take advantage. I mean, we're stretching. We're way over time here on this.
Wonderful.
Give me, as clear and as succinct as you can, what is it that we ought to be doing as a community to protect ourselves as it relates to herbs and a healthy living, a healthy lifestyle? The
first thing I tell people is do not eat in the nighttime. Always clean your system out. Take a couple of days. You see the older people, that's why they live so old. The young people today can never reach 80 and 90. They can't. You think what happened? Because the food is different. The air we breathe is different. The water we drink is different. The older people used to walk. Now we're going from here to there, we're taking a bus. Or we're going to drive.
Or we're driving.
Yeah. So it's a total different world we live in today.
I walked 4 miles to and from school every day.
You know, everybody here is in a computer or a phone.
Yeah.
We have no family time no more. We don't sit on the table and eat as a family no more. Everybody take their food and go into the room. You know what I mean? So the whole is totally different. People don't clean no more. So what I do, look at Ashanti right there, what we do, we create programs. So I said to people, we do yeast and parasite cleanse. Every 6 weeks or every 2 months, take some time off and clean your system out. And keep the bloodstream clean. Clean the organ system, the organs of elimination, because they are your friends. They protect you. But if you abuse them, they have the ability to harm you too. So I said to them, people, take some herbs, clean your system out. If you're eating junk foods, oh yeah, you can eat a junk once in a while. But people eat junk every single day. They eat 3 and 4 meals per day. And they do so and say, oh, and they tell the stomach, shut up and take that. And then after a while the stomach says, listen man, I'm tired of your shit, man.
Enough is enough.
Yeah, enough is enough, man. They give you a little gas pain.
Yeah.
That's a sign. A little constipation, that's a sign. A little skin trouble, that's a sign. A little cough, that's a sign. You can't pay the man, prostate trouble, that's a sign. He tells you. And then you go to the doctor, you get some pills and you feel better, you say, okay, I'll go back and do the same thing again, and you abuse him again. And he warns you again. And he tells you again. You don't listen again, and he says, okay, high blood pressure, heart disease, diabetes, cancer, liver troubles, kidney disease, kidney failure, dialysis. And then you know, who get all these troubles now, want to come to a herbalist after you spend all the money by the doctors and they can't fix it and say, herbal man, fix me no man.
Patrick, let me ask you, okay, this is my last pointed question at you. Not lupus, edema, swelling of the ankles. So I travel from here to Grenada, I get to Grenada and my ankle is swollen.
Right.
How can I avoid that?
Get some borage oil, if it's not your kidney.
Borage
oil. B-O-R-A-G-E.
Borage oil.
Yeah, because that could come from circulation.
Okay.
Or you sit too long. So you could get some plants that help to move the blood. Because you have blood stagnation or blood stasis in Chinese medicine, we call it. So you can move the blood by using ginkgo, horse chestnut, lycium, fruit, hawthorn, leaf and flower, prickly ash, and another herb called lady slipper. You can use those, and they help to move the blood. And then in the cell membranes now, you can put in your borage oil, or your black seed oil, or your flax oil, or your fish oils, and then they go in and they help to produce your good prostaglandin so you don't swell if it's not coming from your kidney. If it's from the kidney, it's probably going to pit. So if your kidney, because your kidney is the water organ, you know.
Right.
And then the kidney don't have to regulate your water balance, so the kidney retains more water than the kidney excretes, you know.
That is true, okay.
But the water that the kidney excretes, retain, goes 2 places. Your liver and the muscles. So you get swelling there too.
You get swelling.
Yes, sir. So if you can use, if it's not from the kidney, you can use some herb that deals with circulation. I just mentioned them a while ago. And get some borage oil and take about 1,300 milligrams per day. And that's swelling will go away. And I want to mention too again, I'm going home on Sunday and I just checked. And I'm negative again.
And you had to, oh yeah, well you had to, you did the test already?
Yeah, it's come back negative.
And it comes,
yeah, because, and they're saying to us that, oh, we could get reinfected. Once our antibodies are high, I keep my antibodies high. I keep them at peak. Then I work on my thymus gland. Because the thymus gland is what produces your thymosin, that produces your T lymphocyte and B lymphocyte. Vitamin C, zinc, and B6 right here. You need it inside there. And they will increase the function of the cells to help to build up your antibodies. So you're talking about vitamin E, vitamin A, all the fat soluble vitamins together. Vitamin K, vitamin E, vitamin A, vitamin D together. Vitamin C buffered for the thymus. Zinc for the thymus. B6 for the thymus. And you eat right. You don't eat in the nighttime.
Was that psyllium?
Selenium.
Selenium.
Wonderful free radical scavenger.
Okay.
There's a trace element, and the soil don't have it anymore. They kill the soil from selenium. So you have to get it from supplementation. You see what I'm saying? What I do all these things, and I keep my immune system healthy. So even though I get a virus, because I could get infected too, you know, I can. I'm not infallible. Right. But the thing with me is, when it comes to me, he can't survive. Because you're armed. Yeah, I'm armed. I prepare for him. So when he comes in, he meets in all my stuff that's ready to fight him and kill him off. But if you have underlying troubles, you have diabetes, you have kidney troubles, you're on dialysis, you have COPD, you have cancer, like Colin Powell, all these guys, and you can't kill no virus that way. You have to keep the body at peak and balance, because the body must work in balance. It can't be off balance. Once the body's in balance, you won't kill anything, because that is what your immune system is for, brother. Your immune system is to what? Is to protect you and to kill for you, but it can also turn on you and kill you too. Right. If you don't take care of it properly.
Thank you.
Wonderful.
Ladies and gentlemen, the night is long, and I have...
Yes, sir.
Oh, thank you for this. Please repeat the number. The number for Ambrosia Health Foods, and I mean, let me just acknowledge those of you who are on the live. Thank you for tuning in, and thank you for watching. The numbers are not great, and I didn't expect it to be great. That's why I didn't put out anything. I was not 100% sure that the show was going to happen, and then we had problems at the setting up tonight and so forth. But Ambrosia is on Church Avenue, between New York and 34th Street, 3306 Church Avenue, 3306 Church Avenue in Brooklyn, between New York Avenue and 34th Street. Patrick is not going to be here for another couple of weeks or months or whatever. We know he's going back to Grenada. They might keep him in Grenada because he's valuable. Plus the fact that his family is kind of threatening him that, you know, you're staying away too long. But anyway, I joke. Yeah. But Ashanti is here at Ambrosia Health Foods, as well as Roland is here at Ambrosia Health Foods. And they are very amenable, is a good word to use. You can talk to them, whatever the issue that you're dealing with or having, you can come in and have a conversation with them, and they will not lead you astray. I've known them, the father in particular, for a lot of years now. When I first started Caribbean Classroom, he was one of the regular guests that I had on the show. We've done several programs together outside of the television studio as well. And I thank you, those of you who are watching. Thank you, Patrick, for being here and sharing with us. And we have a website also. My website is Patrick Dubs. That's where I'm coming to you now. Oh, wonderful. We have to support each other. Roland says he's an honorary Grenadian. His grandmother on the father's side is from St. Vincent. His great-grandmother on his mother's side is from St. Lucia. He says he's an honorary Grenadian, that when he comes to Grenada, the women just treat him royally. So please check him out on Church Avenue, New York and Nostrand, and New York and 34th Street. Patrick, in addition to all of what he said tonight, and we have a lot of information here to play with, Patrick also has his own website. Patrick also would ship to you whatever it is that you are asking for, but he'd like to tell you, give him time, because he's a very busy guy. Yeah. Ambrosia would also, you can also mail, right? Mm-hmm. And the phone number again is 718-469-0985. 0985. Yeah. Right. 718-469-0985. 718-469-0985. Ambrosia Health Foods. Ask for Ashanti or ask for Roland. Either one will help you with whatever areas that you're looking at. Your website, Patrick?
Is PatrickDelvsHolisticHealing.com. PatrickDelvsHolisticHealing.com. I have 32 formulas on my site. There is formulas for the heart, there is formulas for circulation, for fibroids, for prostate cleanse, lymphatic stagnation, after the flux intestinal formulas for the brain, for the eyes, and for the thyroid gland. So it's PatrickDelvsHolisticHealing.com. You can check my website out. And and we have we make some very good products, very effective. Yeah.
And if you're looking to get pregnant, Patrick could help you get pregnant.
Yes, sir. Yes, sir. Yes,
he's not going to get pregnant. He's not going to get you pregnant, but he could help you get pregnant.
Yeah. Even Mary and all getting pregnant too.
Listen, we have to have some fun in between. This is October, the month, and we have breast cancer awareness and all that kind of good stuff. We learned tonight you don't have to suffer because of breast cancer. You don't have to lose your breast because of breast cancer. For those of you who are survivors, you have my empathy, you have my sympathy. However, all is not lost, and you can beat it with some good help and some good herbs. Thank you for watching. And like I said, you never know what you could find on Caribbean Classroom. Thank you so very much, everybody. Thank you, Patrick.
You're welcome, brother.
Thank you, Ashanti. Thank you, Donna. Yeah. Thank you, Joe. The help is quite noted right here.
Yes, sir.
Good night, everybody.
Peace.